Don't transfuse plasma to correct a mildly elevated INR before a procedure. The International Normalized Ratio, or INR, is a laboratory clotting test that was originally designed to monitor oral anticoagulation therapy such as warfarin, but is now widely used clinically to evaluate bleeding risk, liver functional status, and hypercoagulable states such as DIC. It is well established that a mildly elevated INR does not predict whether a patient will bleed during or after a medical procedure. And in fact, the minimum level of coagulation factors needed to support adequate hemostasis in the body is maintained until the INR increases above 1.8 in patients who are not on anticoagulation drugs. There is also no reliable evidence for an increased bleeding risk during most common medical procedures in patients with an INR of 1.8 or less. And transfusion of plasma in these patients is not medically indicated. Furthermore, transfusion of plasma is unlikely to ever reduce an INR below 1.8 in most patients, regardless of how much is administered. Almost half of all plasma transfusions are thought to be unnecessary, and often the risk of adverse events associated with plasma transfusion outweigh any potential benefit. For almost all medical procedures, an INR of 1.8 or less is considered sufficient and safe for adequate hemostasis. Choosing Wisely Canada recommends not to transfuse plasma to correct a mildly elevated INR before most routine medical procedures.